How do ear infections lead to painful ears? Imagine your ear as a busy little world where tiny parts work together to help you hear and maintain balance. When an ear infection strikes, it can turn this peaceful world into a source of discomfort and pain. Ear infections usually happen in the middle ear, which is the space behind the eardrum. They are caused by bacteria or viruses that invade this area, often after a cold or flu. These germs cause inflammation, which is the body's way of fighting infection, but it also leads to swelling and fluid buildup. The Eustachian tube is a small passage that connects the middle ear to the back of your throat. Its job is to equalize pressure and drain fluids from the middle ear. When you have an infection, this tube can become swollen or blocked. This blockage prevents normal drainage, so fluids start to collect behind the eardrum. As fluid accumulates, it can become infected itself, turning into pus and increasing pressure inside the ear. This pressure pushes against the eardrum, which is a thin, sensitive membrane that vibrates when sound waves hit it. When the pressure rises, the eardrum bulges outward, stretching and irritating the nerve endings in the ear. This stretching and inflammation cause the sharp, throbbing pain many people experience during an ear infection. The nerve irritation also heightens the sensation of pain, making the ear feel very uncomfortable. Children are more prone to ear infections because their Eustachian tubes are narrower and more horizontal than those of adults. This anatomy makes it easier for fluids to become trapped, which is why ear pain and infections are more common in young children. If the infection persists or worsens, it can lead to more serious issues like long-term ear problems or even spread to nearby bones, which can cause additional pain and health risks. From a hearing health perspective, the fluid and swelling can temporarily block sound from reaching the inner ear properly. This can cause muffled hearing or a feeling of fullness in the ear. The good news is that most ear infections resolve with proper medical care, which helps reduce pain and clears the infection. If you or your child experience persistent or severe ear pain, it's important to see a healthcare professional. They can evaluate the situation, provide appropriate treatment, and help protect your hearing health. Remember, ear pain is a sign your ear is trying to tell you something, so listening and seeking care is always the best approach.